Hey everyone, and welcome to the Deep Dive. We're going to dig into some interesting trends in Australian private health insurance today.
Our main source for this deep dive is a June 2024 report from APRA.
You know the Australian Prudential Regulation Authority?
Right.
They keep a close eye on the industry.
They do. They're kind of like the financial watchdogs, making sure everything's stable and above board.
Exactly. And this report had some pretty eye-opening figures.
For starters, over 12 million Australians have hospital treatment cover.
Okay.
That number did dip slightly this quarter, though.
Interesting.
Do you think that's cause for concern?
It's definitely worth keeping an eye on. It could just be a blip,
Yeah.
but it could also be a sign of things to come.
One interesting thing is that while hospital cover dipped, general treatment cover is actually booming.
Really?
Yeah, over 14 million people now have it. That's things like dental and physio.
Wow. So more people are prioritizing those extras. It makes you wonder if rising healthcare costs are pushing people towards those options over full hospital cover.
Yeah, it's a complex issue for sure. There are a lot of factors at play. The cost of living is definitely a big one, though. People have to make tough choices about where their money goes.
Right.
And for some, that might mean choosing general treatment now and maybe reconsidering hospital cover later down the line.
Especially since the report shows that most people are getting insurance before they turn 30 to avoid those lifetime health cover penalties.
Right. You don't want to get hit with those.
But we're seeing a growing number of people who are willing to pay those penalties, though.
It's true. It's a gamble for sure. They're basically betting that they won't need major medical care until later, when those penalties aren't such a big deal.
It really highlights the tough choices people have to make, balancing their budget now with their potential health needs in the future.
It's a balancing act for sure, especially when you see how much insurers paid out for hospital care this quarter. Over $4.8 billion. That's a huge jump from last quarter.
It is a big jump. It
Yeah.
just goes to show that healthcare costs are rising across the board. And that has implications for everyone, not just individuals, but the system as a whole.
And while insurance helps, of course, it doesn't completely eliminate those costs.
That's right.
In fact, the report found that the average hospital stay will still set you back about $4,471, even with insurance.
And that's just the average.
Right.
Costs can vary a lot depending on the procedure and the specific hospital.
And not to mention all the other costs like specialist visits.
Exactly. All of that adds up.
Before we get too deep into the weeds of out-of-pocket expenses, though, I want to touch on another interesting trend from the report, hospital substitute care.
Oh, yes. Hospital substitute care. That's a growing trend.
What exactly does that mean?
Well, it basically means getting the care you need, but outside of a traditional hospital setting, it can be more comfortable and often cost less, too.
So instead of being admitted to the hospital for a procedure or treatment,
You might be able to have it done at a specialized clinic, or even at home in some cases. This shift towards hospital substitute care is partly driven by new technologies that make it possible to do more procedures outside of hospitals.
that makes sense. And I imagine it also ties into the growing focus on preventative care.
Absolutely. If you can catch things early and manage them well, you're less likely to end up in the hospital in the first place.
Exactly.
It's about moving towards a more proactive and holistic approach to healthcare.
And as technology keeps advancing, I'm sure we'll see even more innovative ways to deliver care outside of traditional settings.
Definitely an area to watch.
For now, though, let's shift back to those out-of-pocket expenses.
Because even with insurance, those costs can really add up.
Oh, they can. And unfortunately, the report actually showed that the average out-of-pocket expense for a hospital stay has gone up. It has gone up, yeah.
Oh, no. How much are we talking about?
Well, in this last quarter, the average hit $437.51 country.
Wow.
That's a 7.1% jump from the same time last year.
That is significant. Makes you wonder if private health insurance is even worth it anymore. With these costs going up.
Yeah, it's a valid concern. It feeds into this bigger debate about how affordable and sustainable private healthcare in Australia really is, especially as those costs keep going up.
So what's driving these increases? Is it just medical inflation or is there more to it?
And it's a bit of a perfect storm, really. You've got advancements in medical technology, which are great, but they come with a price tag.
Right.
And then there's the gap between the Medicare benefit schedule, the MBS.
Yeah.
It's basically the government's set fee for medical services
Right.
and what doctors can actually charge.
So the government might say a procedure should cost X amount,
Right.
but doctors can charge more and patients get stuck with the difference.
Exactly. And while some insurers try to bridge the gap with gap cover,
Right.
it often has limitations, doesn't always cover the whole amount. So it's
Right.
really important to understand those limitations when you're choosing a policy.
Absolutely. Knowledge is power, as they say, especially when it comes to this stuff. But it's not just about understanding the ins and outs of policies and gap payments, though, is it? There's also the bigger picture of how these trends relate to the whole healthcare debate.
It's all connected,
Right.
really. These rising out-of-pocket expenses raise concerns about whether everyone can even access quality healthcare.
Right?
If these costs keep climbing, it's going to become even more out of reach for everyday Australians.
That's a good point. So with all of that in mind, how can people be more proactive? Like, how can they navigate this complex system and make sure they're getting the most out of their health insurance?
Well, first and foremost, don't be afraid to shop around.
Yeah.
Compare policies from different insurers. It's easy to just stick with the same one year after year.
Right.
But you might find a better deal or a policy that actually suits your needs better if you look around a bit.
It's like anything else, really.
Yeah,
You compare prices before you buy.
exactly. And don't be afraid to negotiate either. You'd be surprised what kind of discounts or extras you can get just by asking. And another thing, regularly review your policy.
Oh, yeah.
Make sure it still aligns with your health needs and your life circumstances. Things change.
Yeah. Life happens.
Exactly. So your insurance should reflect that.
It's easy to just let those renewals roll over without really thinking about it.
Right.
But taking the time to actually review and adjust your policy could save you money in the long run and make sure you're covered for what you need.
Absolutely. And speaking of being covered, there are actually other factors influencing people's decisions about private health insurance beyond just the cost.
Really? Like what?
Well, for one, Australians are becoming a lot more proactive about their health in general.
Okay.
Embracing things like preventative care and wellness.
Yeah.
And we're seeing this reflected in the increasing popularity of doctoral treatment cover and the rise of things like fitness trackers and health apps.
It's like a whole shift in mindset almost. It's not just about treating illnesses anymore. It's about preventing them in the first place.
Precisely. And as this trend continues, it'll be interesting to see how private health insurance adapts.
Right. Will we start seeing policies that incentivize healthy behaviors
It's certainly a possibility.
or reward people for actively managing their well-being?
Exactly. It speaks to this evolving relationship people have with their healthcare.
Okay, so we've covered a lot of ground here. From rising costs and out-of-pocket expenses to this shift towards preventative care and the potential for technology to really shake things up. What are your final thoughts on where we're headed?
Well, it's definitely an interesting time for Australian private health insurance. It feels like we're at a crossroads almost.
Yeah, with these cost pressures and affordability concerns. But then on the other hand, you've got these exciting advancements in preventative care and technology. It feels very much like we're on the cusp of a whole new era in healthcare.
We are.
Do you think these new technologies will really change the face of private health insurance?
I think so. Absolutely. Imagine a future where your health insurance isn't just about covering you when you're sick, but it actually encourages you to stay healthy.
Okay.
Like it rewards you for making healthy choices. Think about it.
We might see policies that work with your fitness tracker, or give you discounts for hitting your exercise goals, or even provide personalized health coaching through apps.
Wow, that does sound pretty futuristic. But it also makes a lot of sense. I mean, if people are taking charge of their health like this, shouldn't their insurance reflect that?
Exactly. This whole shift towards preventative care and personalized health management, it could really change how we view and interact with private health insurance.
Instead of just being there to catch you when you fall,
Right.
it's helping you stay upright in the first place.
Exactly. And this ties in with something else we talked about earlier, hospital substitute care.
Right.
As technology gets even better, more and more procedures and treatments can be done outside of hospitals.
Which could mean lower costs and better experiences for patients.
Absolutely. It could even lead to a future where private health insurance isn't just about covering those hospital stays. It's about providing access to a whole range of care options, like specialized clinics, telehealth, in-home care, you name it.
So looking at the big picture then, what does all of this mean for the future of private health insurance in Australia?
Well, it's pretty clear that the industry needs to adapt. It needs to keep up with the changing needs and expectations of Australians.
Because we're moving towards a more consumer-driven healthcare system, right? Where people are more informed and empowered.
Exactly. People want more control over their own health and well-being, and that includes having more choice and flexibility when it comes to their insurance.
So they expect their insurance to keep pace, offer flexibility, Personalization, value for money.
Exactly. We'll likely see more policies tailored to individual needs, whether that's based on age, lifestyle-specific health conditions. And as technology advances, we can expect to see a lot more integration of those digital health tool and services into the mix.
It's pretty exciting to think about all the possibilities, but for the average person who's just trying to navigate all of this, what's the key takeaway here?
I think the most important thing is to be informed. Be engaged. Don't be afraid to ask questions. Shop around. Advocate for your own healthcare needs.
It's about taking control of your own health journey,
That's it.
making choices that work for you and your values.
Exactly. And remember, the future of private health insurance in Australia, it's not set in stone. It's being shaped by the choices we make every day as individuals, as consumers,
Yeah.
as a society.
Well said. As we navigate this evolving healthcare landscape, it's more important than ever to stay informed, stay curious, and stay engaged in shaping a system that works for everyone. So thanks for joining us on this deep dive into Australian private health insurance. Until next time, stay healthy.